Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Secondary hyperparathyroidism. In secondary hyperparathyroidism, it occurs mainly because of chronic renal failure. Okay, whenever the patient develops chronic renal failure, this will result in okay, there is uh, whenever there is chronic renal failure, there will be calcium loss. So as a result, you will see that there is low calcium. This low calcium will trigger the parathyroid. Now, because of this low calcium triggering the parathyroid gland will produce the hormone parathormone is produced. Okay, so similarly, other conditions like inadequate calcium intake. Whenever the calcium intake or vitamin D intake is less, or if the patient has malabsorption, so both these will result in low calcium levels with resulting in similar features. Okay, then if the patient has right right if the patient has, sometimes it can also occur due to the abnormal parathyroid response. Whenever there is abnormal parathyroid response to extracellular calcium or vitamin D, even then there will be secondary hyperparathyroidism also. So clinical features of secondary hyperparathyroidism include: here in clinical features, the patient will present with hypocalcemia or normocalcemic. The patient can be either hypocalcemic or normocalcemic. Here, the treatment of this secondary hyperparathyroidism is done by medically. We can treat the patient by giving the following drugs. Medically, we can treat the patient. Medical treatment is by giving a low phosphate diet. Phosphate binders are used with adequate intake of calcium and also with adequate intake of 125 dihydroxy vitamin D, or high calcium, or with low aluminium dialysis bath. So with all these uh, drugs, we can treat the secondary hyperparathyroidism. Parathyroidectomy should also be considered. Especially parathyroidectomy is considered if parathormone levels are high despite of medical therapy. Despite of medical therapy, if parathormone levels are high, then we should consider parathyroidectomy in the patient.
thank you and thank you for watching.